Dr. Belizán is a senior scientist in the Department of Research in Maternal and Child Health at the Institute for Clinical Effectiveness and Health Policy in Argentina. He is also a superior researcher at the National Scientific and Technical Research Council of Argentina and a researcher at the University of Rosario. Dr. Belizán is being awarded for the development of innovative, evidence-based, and low-cost global interventions in maternal and child health during the perinatal period that improve well-being and care during pregnancy, reduce morbidity and mortality, and promote equity in vulnerable populations. Janet and I had the great pleasure of visiting Dr. Belizán and his family in Argentina earlier this year, where they taught us about Argentinian food, culture, but most importantly, the tango. Dr. Belizán has chosen Por una Cabeza by Carlos Gardel for his music. Dr. Belizán, please join us on the stage.
Okay, tango, Argentina. Thank you, John, to be here. You was the one to have the merit of this prize at global level, and thank you, in the name of global people, your contribution. We're so pleased about it. Thank you. And thank you for the ambassador to be here. I'm honored of your presence here. Thank you so much. I'm going to read because my English is not very good, so I try to read. It's not easy to express in words the outstanding significance of this prestigious award, one of the most relevant awards given to scientists in the world. The most rigorous evaluator that a scientist has is himself. We are always hesitant about the results of our studies. Did that make a good design, a good study? Can we trust in the results? What about others authors performing similar results? Being recognized by such prestigious committee as the Gairdner Awards Committee implies a validation of what we have done. It was a long journey of research. In our case, almost 50 years devoted to research, looking for finding interventions that can alleviate populations at global level with an emphasis at reproductive period of life and looking for global attainment and equity. You cannot imagine how proud and happy we feel. Our studies were done in many countries all over Latin America and with the participation of hundreds of collaborators. All of us, all of them, have felt a sensation of pride after the news of the award. Not only proud, but also recognition implied that all of them can do research of the highest quality being globally recognized. Our research did not imply great amounts of money. It was mainly done following the observation of population needs, posing questions regarding population situation, and looking and testing interventions that can improve the situation of the population with major needs. In my country, in the city where I live, we receive too many demonstrations of pride from the people around us. They feel proud. We can do it, they say. We can be at the highest level and recognition worldwide. Demonstrations range from a free breakfast in the cafeteria where I usually have breakfast to a personal greeting from the president of my country, Argentina. I would like to say that receiving such an award from a Canadian organization has for me a singular feeling. In my career, I have had relationships with many Canadian researchers and officers from the East Coast at Université de Laval, at the West Coast, British Columbia University, going for many universities all around Canada. I have had many interactions with Canadian scientists, and in all of them I have received their strong, respectful, and generous support. I am very grateful for their collaboration and friendship. Well, you know that the first grant support that we received in 1980, long time ago, was given by IDRC, the International Development Research Center from Canada, in my city, Argentina. Yes. With this support, we managed to do the trial that derived in an intervention to prevent a severe complication of pregnancy that can save over 500,000 lives of maternal and children deaths every year. Further from this, RDRC support was continued with a training grant that allowed us to receive fellows from all over Latin America, resulting in them being able to apply and spread research methodology in their sites. Also, IDRC support a network of researchers all over Latin America, and we do research jointly with many Latin American universities, like where you, I don't know, there is Cesar Victor. Hello. I wish to mention a long life of family solidarity atmosphere created and led by my wife and followed by our children and their family. This is the atmosphere of solidarity, behavior, generosity that should be spread and shared in every family and in the social and work environment. Thank you again for all Canadian colleagues who over many years have given us their friendship, their support, and their generosity. Thank you again to all of those working and supporting the Gairdner Initiative. What you provide goes beyond science and means that you are able to support and spread the efforts of many researchers who seek to improve the quality of life of our population. I warmly thank you and support you. Please proceed with such outstanding humanitarian mission. Thank you so much.